news about people having to be intubated? That word baffles me. The medical term is really endotracheal intubation. Say that a few times. It became an everyday word with the media talking about the approved way of providing breathing help to COVID-19 patients. This intubation and ventilation supports a COVID patient's breathing, supposedly so the body can survive as the immune system is fighting the virus. It's probable that a patient is unconscious when a medical team suggests the need to insert that tube. It's a flexible plastic tube that's slipped within the trachea. It goes into the mouth and down into your trachea, which is that large airway from the mouth to the lungs. Yeah, it sounds scary. It's better to be sure that if you don't want to undergo this procedure, you put it in writing or state the amount of time you're willing to endure it before you want it removed. Yeah, I know. There are lots of possible complications of this endotracheal intubation. It could be put into the wrong place, like into your esophagus, the part behind your trachea. Brain damage, cardiac arrest, and death could happen. If stomach contents are aspirated, it could cause pneumonia and ARDS, which is when the fluid leaks into the lungs. No, don't confuse it with do not resuscitate order, a DNR form. Those are created for patients that do not want to be saved in the event their heart or breathing stops. This is generally the case for individuals with late stages of cancer or other advanced medical issues. The laws for withholding resuscitation are governed by each state and usually come with a requirement that the patient authorizes the form along with their primary care doctor, notary public, or a witness or witnesses. The website www.eforms.com/DNR has a template for every state. A hospital often asks patients if they want to complete that form when they're admitted, but often the patient is already too sick, too worried, or confused to make a good decision. Reasons you might want to make sure you have a DNR on file would be a long-term illness, prolonged pain, really old, terminally ill, dementia, or Alzheimer's. By the way, your living will, you know that form, also called an advance directive, that could include a DNR. It could include a do not intubate, that's DNI, and a do not hospitalize, DNH. Those are two more legal documents that give you control over your medical decisions. Are you confused? I think it's all teaching me that I can't make believe these decisions don't exist. I can't keep acting like I'll think about this when I'm really old. Because what is old anyway? And then there's the newer POLST, PULSE, or Physician Order for Life-Sustaining Treatment form. That can be completed depending on the state you live in. Yeah, wow, it's a lot. And to make things even harder, most states don't even have a simplified DNI form. It's more likely a discussion between the doctor and the patient or a family member. But remember that with COVID rules, a lot of patients are completely alone, and overworked medical staff weren't talking to others about that decision. Wow, I'm not sure I want to have to deal with all this when I'm fighting for my life. I need to learn more. I'm happy to share it, Nicole, later.